Hi, good morning, everyone. Good evening, good night, depending on where you are, and welcome to this webinar. I'll be presenting, my name is Sam Wambugu, and I'll be presenting with three other of my colleagues, George from Kenya, Samuel from Ghana, and Suresh from India. I'll start now. Now, the background to this webinar is we have been working for quite some time on digital health or health informatics, and we have been experiencing gaps in the low and middle income countries where measure evaluation does work. And so that background led us to start to think about how we can work with other universities to bridge the gap in digital health, especially because many of the countries where we work are mainly using paper registers and forms in their data collection and management. Others are in a situation where they have part paper and part technology. And in those countries, some of the information systems have migrated to purely paperless. Now, first, I'll start by describing who Germinate is, Germinate Health is. This is the global evaluation and monitoring network for health, an organization made up of 9 universities, as you can see on the map, which we work with measure evaluation. Now, the purpose of Germinate is to foster organizational growth, collaboration, and mutual support for monitoring and evaluation of health programs around the world through institutional linkages among the members. So, this is a network for building capacity on monitoring and evaluation in different parts of the world, spanning 4 continents. Now, on the other hand, measure evaluation, which is the secretariat for Germinate, has a strategic objective to strengthen health information systems, both globally and also at the country level, mainly to improve the capacity to gather, to interpret, and to use data within the health environment, so that the countries can use this data to make better decisions and sustain good health outcomes over time. So both measure evaluation and Germinate main objective is to strengthen systems for generating information, otherwise also called monitoring and evaluation. So through this webinar, we're going to talk to mention the word health informatics, and we know that they are varying. This is a growing field, and health informatics has various definitions. And we will be using the US National Library of Medicine definition, which states that health informatics is interdisciplinary study of the design, development, adoption, and application of information technology-based innovations in healthcare services delivery, its management, and also planning. And looking at digital health, there are various layers that you can think about it. You can think about technology and how it interfaces with clients or interfaces with patients through use of mobile applications and knowledge, through self-testing diagnostics, issues to do with SMS technology to interact for patients or health workers and patients to interact, as well as patient portals where knowledge base of health information is generated for access by patients. And then if you look at the layer outside of the patients is the health professionals. Health professionals are increasingly using technology at the point of diagnosis. They're using it at electronic medical records. They're using it as e-learning tools in decision support. So there's a wide array of uses of digital technology among the health workers. And then there is the enabling environment that makes this happen. This is at the point of healthcare organization as policymakers in mitigating fraud and abuse of, say, logistic management systems, in disease surveillance, in analytics, in policy or laws that govern the use of digital technology, in patient data management and analysis, or governance of digital health products, and in inventory and stock monitoring. So there are all these layers and much more than that. And this is from the Broadband Communication Commission of 2017, how they try to categorize those 3 layers of use of digital health at various points of care, and also for these 3 different categories. As we saw from the last World Health Assembly resolution, digital health is being recognized increasingly as an important element within the health management and health service delivery. And these are only 3 of the bullet points that we were able to call out of a broad resolution from the Assembly, recognizing that digital health has a role in advancing the Sustainable Development Goals. And also, it is important complements integrated people-centered health services. And also it helps to contribute to improved population health, improved health equity, and also including gender equality in health services. So the more reason why we want to build more capacity in the area of digital health, so that we can increasingly, move towards sustainable development goals and also bridge the gaps that do exist between health services. But in doing this, the Health Assembly also identified certain promises and also certain challenges. For example, one of the promises is that low and middle income countries are betting big on health informatics. They see digital health as an important tool in reducing inefficiencies, in improving access, reducing the cost of provision of health services, surveillance and prevention of diseases, and also improving quality of care. But also it recognizes that there's a widening gap between digital health and also the capacity. And therefore sustainability is in question when technology is moving so fast, yet we are not producing people with the right skills to match with the technology growth. Therefore, the other element, of course, is where systems are developed without involvement of health workers, who are ultimately the people who are supposed to use this technology. And therefore, co-creating these products with health workers is an important element, but they can only be meaningful participants in this process if they have the skills that they need to bring to the table and inform the development of these products. Therefore, with that background, measure evaluation and the Germinate Health partners came together to start to think on how to build, to bridge the gap between technology, between health, and bring to the table the experiences that we have from the implementation side, because measure evaluation with funding from USAID does a lot of implementation of digital health, but Germinate Health members are also interfacing with students and people who want, and countries that they want to build digital health capacity. So in doing this, we started by conducting an assessment. We wanted to know where we are, or where the countries where we work are in terms of digital health or health informatics. We wanted to know who is offering health informatics trainings. And in those trainings, what is covered, what's the content of that training? And what are the organizations, ministries of health, and health professionals asking for in terms of health informatics? And in doing that, without going to the details of how exactly we went through the assessment, the list that you see on the screen present a snapshot of what we found out, that analytics and statistics is on demand, is in high demand. That data management, information, and information system governance is something that both health professionals and institutions want to know more. Health information systems and applications, whether they are electronic medical records, dispensing tools at pharmacies, and other mobile health technologies that are used for collecting and management of health data. Another area that was mentioned on increasing demand is data ethics, data regulation, and also a system to accredit health professionals who are seasoned in digital health, so that ministries of health, when hiring them, can have some level of confidence that these people are accredited to have the right capacity. Then there's strategic planning, organization and management and leadership of digital health standards, various standards required in the digital health and ecosystem. And also there was a mention of telemedicine, especially to bridge the gap between communities and health facilities in resource limited settings, and how they can connect with endowed health professionals in major cities or other countries to tap into that their expertise. With that background, then we went to work. We started to put together a curriculum that addresses those areas that were mentioned. We made references, or we adapted quite a number of materials from Office of National Coordinator for Health IT in the US. We adapted part of their curriculum. We also looked at measure evaluation materials, and the ones that were fitting, we also adapted them. The universities on the screen, that is Public Health Foundation of India, University of Pretoria, Kenyatta University, and University of Ghana also contributed their expertise, the materials, and also participated in reviewing the content to make sure that it meets the demands that they experience day to day from their clients. So the result was the curriculum outline, or the entire curriculum, and on the screen is the outline. So the outline consists of the items on the screen: health informatics overview, clinical decision support, telehealth, privacy, security, and confidentiality. It has modules on technology, people and processes, and how they interface. Process engineering. Technology is coming to a field that has been using papers and register over a period of time for many years, and therefore technology is helping in re-engineering that process. Electronic medical records. We have a unit on databases, data warehousing, information network, information systems, and information exchange, analytics, and usability. So in short, this is the content of the curriculum, and we'll be talking about that in detail. And who is the course designed for? We identified 3 main categories of people who are potential beneficiaries of this course. This is the health professionals, the doctors, nurses, clinical officers, health informatics professionals, non-clinical and administrative staff, because they have a role to play in understanding the interface between health and technology, and also the IT professionals who are more and more coming into health environment to support or to tailor-make their products to be suitable within the health environment. Then after the course was developed, we wanted to offer it to the audience and see how it flows before we can make it open to the public. And so we went ahead and worked with one of the Germinate members, that is Kenyatta University in Kenya, to offer the course to participants who signed up from around the world. And this happened in July, within a week, between 23rd and 27th. On the screen, you can see to the right is the Vice Chancellor of Kenyatta University opening the course, and to the left, you can see a small group of the participants. And it was intended to be small, being the first one, so that they can both learn and also make input into areas that we probably can improve on before we go public. And at the end of the course, we asked the participants, what were their experiences? What would they like us to do better? What did they like about the course? And they told us that they want more on big data analytics. They were expecting also to see a little more on machine learning, maturity models, artificial intelligence, and data demand and use. So these are additional items that they said they wanted us to invest more in developing this curriculum. But they said they liked interoperability of information systems, and they also like digital health standards most of the units that we covered. They said the 5-day course did not give them as much hands-on exercises as they required, but because of the cost, we had limited the course to 1 week. Potentially, this course can be offered over a period of 2 weeks. So we made it vary depending on the situations. And also, they would like to, although Kenyatta University was generous to us, they opened their university hospital, which is modern, just about to be opened, for us to experience some of the concepts that we learned. They also said that it would benefit from more field work. And some of the participants asked if the course could be made online so that wider audience can benefit. So in closing this session, this curriculum was developed to meet a growing demand in low and middle income countries. And it was a collaborative effort from the 5 universities and Measure Evaluation. And today we are making this course public. So it's going to be a public global good for you participants and others out there to make use of. The course is available online on the link that you can see. And you don't have to struggle to type this, because we will be sharing with you this material. You can go online to Measure Evaluation, and on the landing page of Measure Evaluation site, you can see you find the link to the course, and you can download all the PowerPoint slides and other auxiliary materials that we put there for use. So now, after offering the course, some of our partners in Germinate started to think on how they can use this material within their own environment. And now we are going to hear from Suresh from India on how they are making use of this material in their training. Welcome, Suresh.
Hi, thank you, Sam. Can you hear me?
Very well.
Yes, I'll just continue with where Sam stopped on. As you see, the course content is kind of an evolving thing, and health informatics has a very wide definition. We have been in Indian Institute of Public Health, which is part of the Public Health Foundation of India. We have been offering this master's and PhD program in health informatics since 2013. And our course content is also kind of evolving. And intentionally, we are actually opening up this program, which was initially at least focused more on people from a healthcare background, to literally people from all backgrounds. We have students from engineering backgrounds, mathematics backgrounds. So the eligibility of our program is simply any 3-year undergraduate program. You could actually look up on the website phfi.org for further details. And we are actually planning to use the content that that emerged as part of this development with partnership with Germinate to come with a short distance learning program in health informatics, which hopefully will be launched by the end of this year or early next year. And also we will use this curriculum content to integrate into the existing master's and PhD programs also. The purpose of this is to kind of speak a common language. Health informatics, as I said, has a different understanding with different people. So we need to kind of have some kind of a common understanding, so that even recruiters or people who reach out to our students understand what health informatics actually means and what our students are actually learning and coming out as part of this program. And next slide, please. In the program that we are running, we are adding a little bit more on the newer technologies in healthcare. So our broad understanding of health informatics is also integrating all these newer technologies like artificial intelligence, augmented reality, the virtual reality, computer vision, geographic web services. So our program slightly has an overdose on this. And we also try to kind of add up newer technologies into this program and make it a little bit more customized. We also have a website which is called as healthinformatics.in. You could also have a look at it. And there is also another website called as www.geohealthcare.in, wherein you can find some of the examples of our work. So again, this was also something that came out of the meetings that we had, that we need to have examples of health informatics in application in LMIC countries. So we are trying to put up as much information as possible after due diligence and publications into public domain. So we have a YouTube channel which is called as 5 Point Health. So all you need to do is open up YouTube page and type in 5 Point Health all in text in the search page, and you'll go to our YouTube channel. And here you can see some videos that we basically means the faculty and students of the health informatics program have actually developed. And herein we are trying, we'll hopefully in the near future put up more and more content based on the content that we actually developed as part of this collaboration. Next slide, please. Well, I guess that's part of my presentation on to University of Ghana, I guess.
Yes, thank you, Suresh. Sam, are you online? Okay, so as we wait for Sam to come online, we will go to Kenyatta University. Hi, George, please go ahead.
Hi, everyone. I hope you can hear me.
Yes, George, we can hear you.
I'm sorry, I'm next to a busy road, so you may hear the vehicles moving. Now, in Kenyatta University since 2009, we had started offering courses around health information management, but apparently most of these courses to date, we haven't reviewed them to ensure that they are in line with the developments across the world. On this screen, you can see we are already offering a course in health records and information management, which because of the shift that we are seeing in terms of application of technology in managing information in healthcare, we are currently introducing more technology-driven approaches to health records and information management. We are also offering health information management, which also slowly we are shifting it into a more elaborate health informatics course. Now, this workshop and the materials that were developed through the collaborative efforts of the 5 universities and the measure evaluation has really become handy because they have given us areas that we need to review and incorporate into our curriculum. Next slide, please. Now, we are also offering a PhD course, which is also basically at the moment, it is around health information management. And since also the Commission of University Education requires currently in Kenya that all PhD courses be offered by coursework, then we had to develop content for the PhD course. And here I have highlighted a few of the areas which we borrowed heavily from the materials that were developed in this health informatics course for the low and middle income countries. As you can see, one of the units that we have introduced in our PhD course is the consumer health informatics, which obviously will be offering it in a more of a seminar format. And we are also looking at public health informatics. Next slide, please. We are also, we'll be doing a seminar on health information technology, and then a seminar on health information management, where we'll also be bringing in issues of analytics, so that we are responding to the current market. But we have having been talking to our partners, collaborators in Kenya, especially Ministry of Health, we have realized there is a huge demand for the workshop that was conducted in July that Sam mentioned about. And so as Kenyatta University, we are now thinking of making it an annual short course, which at the moment we are thinking of it being just a local workshop for the Kenyan community, but we'll assess if there is a demand beyond Kenya so that we can mount it to internationally. But already the plans are underway to set dates for the workshop for next year. Next slide, please. Oh, thank you so much. That's what we are doing currently in Kenya. And I think now I hand over to Sam for the rest of the presentation.
Yeah, thank you very much, George. I'd like to check if Sam has come online. Sam from Ghana. Okay. Well, we'll bring Sam online on as soon as he's able to join. But Ghana, University of Ghana also has plans to integrate some of the materials from this curriculum into their master's programs. And therefore, these are three examples from some of the partners from Kenya, from Ghana, and also from India on how these materials are being used for bachelor's courses, master's, or adapted as part of the PhD courses, or otherwise customized short courses. Now we will be opening up this for question and answers for the remaining part of this webinar. Yeah, please feel free to type in your questions on the Q&A section on the screen. We already can see a few of the questions that are coming in. We will respond to these questions. So one of the questions that has been asked is, what are some best practices, if any, in co-creating with health workers? Sam and George, if you have any response to this, please feel free to chime in at any point. And also if there are other people online who may have other experiences for co-creation, you can type your answers on the box as well. One of the experiences I've observed on co-creation is that recently we worked with the Ministry of Health of Uganda, and in some of the interactions we had with some of the implementing partners, we were informed on how they have communities of practice that have both the technical people, the IT staff, as well as health workers who work together, think through programs together, or digital programs together before they are implemented, and that in a way is going well in ensuring the sustainability of the products that are finally deployed, because they have both the fingerprint of both the IT people as well as the health workers. I see another question from Aileen. She's asking, what recommendations do you have for universities who are just beginning to think about developing health informatics courses? And she goes on to ask, and what resources are available to help them? So certainly, as you have heard from both Kenyatta University in Kenya and Suresh from India, these materials are now, they are adapting these materials, and you can as well adapt them. They are, they are global goods for use by anyone who would like to use them, to adapt them and use them as a foundation and improve on them as the situation demands. However, Eileen, you can also get in touch with Measure Evaluation to see if there's any more we can do to work with your university or other universities in getting these materials into your hands. There's a question here from Stephen, and Stephen is asking, what is the cost implication to participants in the classroom course? Now, this varies, and I would like Suresh to chime in here, because it seems like, and George, because you're, as you said, you're adapting this material, and I'm sure the cost will be different. While we were planning, or when we were pricing the course that we had in Kenya, the cost were varied, because some of the participants flew in from other countries. We had participants from Geneva, from Zambia, Tanzania, and so that went into the cost of the course, and also tuition and accommodation. So there will be variation depending on whether the participants will require accommodation, or they are within the city and they can walk in and walk out, or they'll be traveling internationally. Again, we'll be more than happy if Stephen or anyone else would like us to send them a template that outlines the cost elements that go into pricing this course. Yeah, and also one more point to add, it also depends on the length of the course. During our first offering, we made this course 1 week. If it went for more than a week, certainly it would be much more expensive. And also we had faculty flying in from different countries to come and participate, which also increased the cost of this course. I see a question from Fred. He's asking, are the degree programs offered at Kenyatta University online or classroom? George, would you like to pick that, please?
Thanks. Currently, most of the programs at Kenyatta University are on a blended mode. Blended mode means there are some elements that you can complete through online and others through classroom. So it is a blended. You can the full degree cannot be fully taken online, but some aspect of the degree can be done online.
Thank you, George. The other question here is, what are the tentative tuition fees for health informatics programs in all universities? This is a little difficult for me to answer, because different universities have got their different pricing methods. When we offered this course, tuition for 1 week was about $660. And the reason why it was that low or that high, it was because of the factors that we put into it. I'm sure it probably can be offered at a lower price, and also the price can go higher depending on how long it's offered. So the issue of the length of the course, there is the core materials that we used within the 1 week course, but depending on the experience of the participants, we also have another batch of materials, supportive materials. And if those additional materials are added to the core materials, this would very well push the course from 1 week to 2 weeks. So that's why we are saying that the pricing varies depending on the length of the course. Yeah, there's one more question from Sandeep here, asking, will there a student exchange program? Suresh, is this something that you've thought about?
Hi, I guess it's a bit too early to talk about a student exchange program. And also it's a bit odd to talk about student exchange when we are promoting digital exchange here. So I guess we'll have to put in as much as content as possible on the internet and try to exchange first, and then possibly think about physical exchange.
Thank you. Jacqueline is asking, what about other languages such as Spanish? One of the partners is in Mexico, according to the map shared in the presentation. That's correct. At this initial stage, we developed the material in English, but we are thinking in future to translate the content to French and Spanish, depending on availability of resources. So watch this space and stay tuned. A question from Yo Antwi is asking, how can one partner with you to extend this training to cover the areas mentioned, such as machine learning, data visualization, and mobile data capture? Yo, please get in touch with us, and then we can see how we can explore that further, depending on the need that you have. Mavis is asking, saying this is excellent. Thank you, Mavis. To ensure this knowledge will over time be effectively utilized in the health sector, it will be useful to know how many of these students will eventually end up in the health sector as practitioners. Well, I think the students who we had in Kenyatta, they were sponsored by the organizations or ministries of health. And that is a testament to the fact that they will be absorbed by, they're already working in those organizations at government. Therefore, they should be utilizing those skills there. And even if they get to move to other organizations and countries, the capacity is already there to support the countries. But this is an important area for us to keep on checking as we have more and more students graduate out of this course. Meha is asking, is there any health informatic models? I'm not sure if I understand the question. Sam or George, if you have an input to this question, please feel free to chime in. Okay, question from Japheth. How big is the demand for healthcare workers, especially in the rural setup where ICT infrastructure is a challenge? A very good question. Suresh, you are on the ground. Would like to give a perspective from India? Suresh, are you there? Okay, let's check if George is there. George, can you take a stab at this question? What is your experience in the use of, in the demand from the healthcare workers, especially in areas away from the cities where ICT infrastructure is challenging?
I think the demand is growing as more people get enlightened around the mobile tools that are used in managing healthcare. And so there is no rural area now that probably is not penetrated by ICT aspects. And we, in Kenya already, some of the courses that we offer through online, our students are able to access materials from any rural part of the country. So this field is growing, and we just need to keep up to the speed of the demand.
Thank you, George.
Hello, can I add to that question? Sorry, I was not able to add in previously. There is a lot of demand for digital health or health informatics content on the ground. In India, there is a specific issue of languages also. So a lot of content on the ground has to be translated to local languages for it to be reaching out to wider sections of people, and especially to people who are actually working at village and rural level. So this is a bit of a challenge to us, and we are trying to kind of translate whatever we are doing into local regional languages and take it forward. And that is where some of the work that we have done has been uploaded onto our YouTube channel also.
Yeah, thanks, Suresh. And that's partly also addresses question from Charles, who is asking whether it is possible to filter content to fit lower cadre community health volunteers training who are at the base. So through those translations, it's possible to get that content, whittled down to fit groups depending on their experience. And also, as you will see when you go to the measure evaluation website where this material is now curated, you'll see that it depends on how the facilitator interprets them or picks the units that are responsive to certain needs of healthcare workers. If you want to go an extra mile like Suresh and go into machine learning, artificial intelligence, you may want to add that. But also if you're looking at engaging with community health workers to get their understanding and also input in developing the solutions that are fitting for them, it is also possible to do that. And for those of you who are also typing in your answers to respond to these questions, we appreciate your engagement and the perspective you're providing to some of these questions, and we'll be able to put together all these answers and share with everyone else. Billy is asking, co-creation with health workers is important in low and middle income solutions, feasibility, design, implementation phases. Therefore, he's asking, does the course have plans to offer hands-on skills and practical learning on this? We did do that. During when we were offering the course, we had practical exercises where we did data visualization. We did some hands-on data analysis. And also we had one of the units which we went through a process mapping theory and rationale, as well as other exercises for process analysis for organizational units. In other words, there are, within the course, there are, for every unit, there's a number of exercises that give the participants hands-on experience so that they do not only get the theory, but they also get the hands-on experiences. We have a question from David, and he's saying that he's interested in big data, data analytics, and artificial intelligence, or AI. He's asking whether he can get the online materials. Yes, these materials for this course are available online as of today. You can go to their website and download. Probably, there are many slide decks, and you can pick the ones that are relevant to the areas that you want to learn, but we didn't have much on big data on this current module. George, there's a question for you from Martin. Martin is asking, when is Kenyatta University planning to do their short course?
Thanks, Martin. Currently, we are still at the planning stage. We are not yet concrete in terms of the dates and even the months. What we know, we want to do it next year. But as soon as we finalize the plans, we'll share widely through the various channels that are available, including the measures evaluation platform. Thank you.
Thank you, George. Fatma is asking, it will be great to learn from you on strategies to encourage adoption of these evolving technologies and deal with resistance to change. Good point, Fatma. I think we are increasingly getting more and more health workers saying we need to be involved, we need to be part of, we need to be co-creators of these products. and that way they are more likely to be sustainable. But we take your point positively that as we roll out this capacity and these products to learn from them and see how we can encourage adoption and share lessons. Ronald is asking, how could public-private partnerships support their skills building endeavors?
Hi.
So we are still exploring how public-private partnership can come into this space and pick up. I don't know whether, Suresh, you have any experiences on public-private partnership. During the course in Kenyatta, we had one participant supported by another private university to be part of the course and to go and pass on the skills to the health workers within the institution. This is certainly one area to explore, our public-private partnership. Suresh, do you have a perspective you could add to this?
Yes, I guess at the moment, the health informatics on the secondary, tertiary levels are all supported by private organizations because the electronic health records is a major business that is good for them also. But if you look at rural care and primary care, at this level, government is the primary player, and public-private partnership is kind of a little bit challenging at this level. So yes, on one side, there is strong private support for people to be taught about how to use electronic health records. But on the other side, where government is the major player, it's still an ongoing process to bring in private players onto the field to support. Some are willing to support in the name of corporate social responsibility, but it is still a long way to engage them for a long-term purpose.
Thank you. George, do you have anything to add to that?
Not really, but I guess what you've highlighted that in the course that we conducted, we had a participant from a private entity. But I guess, again, moving forward, in terms of this skill building, one way of collaborating with private partners is to allow them send in or sponsor some of their workers into the courses whenever they are offered. Thank you.
Thank you. And if Sam Dery from Ghana, if you are able to join, as soon as you're able to do that, please let us know, and we'll allow you to speak about your experiences in Ghana. There's one more question from Fatma, and she's asking, what are some specific best practices around sustainable development you have applied in digital health programs? Is looking for specific best practices around sustainable development in digital health programs.
Well, I'm not sure if I understand the question well, actually.
Yeah, the question is if through the deployment or training of digital health programs, this is what I think the question is asking, if there are best practices on what makes these digital health programs sustainable.
I guess the first step would be to kind of speak a common language, which is what we are actually trying to do as part of this partnership here itself, to define what is the course content, what is the curriculum, and make sure that more people get on board, so that even within India, hopefully, we are trying to reach out to other institutions and then offer them this content and make sure that the students who are taking up this health informatics program across the country and globally actually are studying the same part. So I guess this is the first step that we are actually trying to do, and as we go forward, we'll possibly have more and more best practices to share.
Thank you, Suresh. And to add to Suresh, one other experience we can share from measure evaluation is that availability of community of practice, including a help desk that supports these digital health solutions as they are deployed, goes a long way in ensuring sustainability. Health workers want to feel supported, and that support should be available 24/7. So that when they get into problems, there's someone who they can call on to support them. So a vibrant help desk is critical, and we have also identified that a community of practice that shares their own experiences does help in ensuring that these products are sustainable. There's a question from Adjos, and the question is, would you talk a bit more about scaling up this intervention? It was not very clear during the presentation how to scale up. So this intervention or this course is actually available online. It's freely available online for use by organizations and individuals. You just need to go online, download the material, and you can adapt. Should you have any questions as you try to adapt this material, you can get in touch with us, and we can be of help. And as we said a little earlier, in future, I would like to make this course available in other languages like Spanish and French. And there are some discussions of possibility of making this course an online module in future. We are now out of time, and therefore we can answer a few more questions for those of you who would like to stay online for a few more minutes. Otherwise, the recording for this webinar will be made available to all the participants. So feel free to stay on for a few more minutes. We can respond to a few more questions. Otherwise, thank you so much for joining, and you'll get the recording. There's a question from Walter. From Fabian Walter asking, what are the standalone masters in big data? If there are universities providing standalone masters in big data, please feel free to type in your answers on the answer box to respond to a question from Fabian. Japheth is asking, what is the duration of the course at Kenyatta University? So we provided this course for within 1 week. So this was an 8 to 5 course for 1 week, but the content can be offered in 2 weeks. So it can be modified to take a shorter time or longer time, but we did it in 1 week, but potentially for 2 weeks. There's a question from Said. He's saying that in Afghanistan, the technology-related innovations are supported by USAID projects such as the Palladium. Does USAID support building capacity in this area too? Which area? Thank you, Said. So this course was by itself supported by USAID to measure evaluation and Germinate partners. And I think there are many innovative programs out there that USAID does support. And maybe if there's a participant from USAID online, will be able also to respond more specifically on the situation or innovations in Afghanistan and other countries. But we are aware that there are many out there, including this program was supported by USAID. Now I'll take 2 more questions and then we'll wrap up this session. Mark is asking, this update overview is excellent. Thank you, Mark. I will be teaching a course on global health in the spring and hope to leverage some of the health informatics curriculum you have prepared. Very timely. Thank you very much, Mark. As you offer the course, if there will be any feedback, we'll be more than happy to take it and see how we can improve our course. Now, the last question for now comes from Eileen. The measure evaluation online course tries to cover a lot of areas, ranging from more complex to more basic. Therefore, is asking, have you considered creating a more advanced course and basic course? Yes, it depends on the resources, as you have pointed out. So for now, we will take feedback from Mark and other universities that are offering this course, and that will inform us on the direction we can take after this product is offered. So we'll use that as evidence as it comes. So we have more questions coming in, and we will take time to respond to them in writing, and we will, as we share the online the recording, we will also share our responses to those questions and also answers from other participants. So from all of us, George from Nairobi, Suresh from India, and ourselves here from Measure Evaluation, we thank you all for joining this webinar, and we're looking forward to more feedback when you write to us directly. Thank you. Bye-bye.